Alternative medicine are treatments that are not typically part of conventional medical care or that may have origins outside of usual Western practice, and they're used instead of standard medical care, instead of standard medical treatment. So most people don't actually completely eschew the standard care and just do alternative care, okay? Complementary medicine then, or we're shifting now to complementary health care, are treatments that are not conventional but are used alongside conventional medical treatments. So let's see, examples are like things shown in the pictures here, which I took off of the NIH website. There's some Tai Chi, having green tea, acupuncture, massage. We'll hear a lot about different treatments today. So the next term on here is integrative healthcare. And integrative healthcare brings conventional and complementary approaches together in a coordinated way. And it emphasizes a holistic approach to the patients. It's patient-focused. And it addresses the whole person rather than one organ system. Some people refer to this as the goal being treating the mind, body, and spirit. My bad. Sorry. Okay. We can learn about the evolution of the language by looking at the evolution of a center at the National Institutes of Health. So I thought this history was pretty interesting. The Office of Alternative Medicine was established at NIH in 1992. And then in October of 1998, Congress authorized its transition into an independent center at NIH called the National Center for Complementary and Alternative Medicine, CCAM. And then in December 2014, Congress renamed NCAM to the NCCIH, which is the National Center for Complementary and Integrative Medicine, to reflect the actual healthcare practices in the U.S. and better reflect the mission and research focus of the center. Interestingly, in 2001, so before NCCIH, the NCAM and the National Library of Medicine combined, or they partnered together to launch a special section on PubMed for complementary and alternative medicine called CAM. So if you're interested in this literature, you can go right to that section to find out about it. And also interesting to me is in September, the NCCIH will be celebrating their 20th anniversary, and there's going to be a one-day event at the NIH campus, which is right across the street from where I work. Maybe I'll go. So there were surveys conducted sponsored by NCAM and the NCCIH, so during the time before the transition to NCCIH, that looked at how many people actually use some sort of complementary healthcare approaches in the United States, and found out that about a third of American adults use complementary healthcare approaches. And that has stayed stable over many years. There's been 3 surveys listed here. There was another survey in 2017 with some updates I'll tell you about in a minute. And also, it's not uncommon for children to use some sorts of complementary approaches. So the most common complementary approaches you can see here. These are the 10 most common approaches used by adults from that survey that was done in 2012. And natural products was the most common, not too surprising. This particular survey excluded vitamins and minerals, but included other dietary supplements in that questionnaire. So what do you think is the most common supplement used? Not standard vitamins and minerals, but anybody have any guesses on what the most common supplement is that people use? Fish oil. Surprise? Fish oil, yeah. 7.8% of adults use fish oil, and that's actually increased in recent years. Fish oil, probiotics or prebiotics, and melatonin were the most common ones listed. Yeah. Currently, the NCCIH does include vitamins and minerals in their listing of natural products. So it includes herbs, botanicals, vitamins and minerals, and probiotics. The next most common is deep breathing at 11%, and then some movement strategies for health, yoga, tai chi, or qigong. Which one do you think is most common? Yoga, yeah, of course. Exactly. So nearly 10% of adults in 2012 and 14% in 2017 practice yoga, at least some. And generally they say that it improves, reduces stress, and also increases their motivation to exercise and eat healthfully. So nice correlations there. Qigong and Tai Chi and Qigong are related in case you're not familiar with them. They are both centuries-old mind and body practices that involve certain postures and gentle movements with mental focus, breathing, and relaxation. The primary difference is that Tai Chi movements, if they're done quickly, can be used as a form of combat or self-defense, where Qigong doesn't have that aspect. Meditation has jumped up dramatically since 2012. As well, from 8% to 14% in 2017. So that's becoming more popular. And massage is also one of the more common ones there at about 7%. So the NCCIH has a long list of mind and body practices on their website, and most of these are probably familiar to you. Everybody know these? The only one I wasn't familiar with actually was the Traeger Psychophysical Integration, which is listed on the site. That involves I looked it up, it involves a combination of hands-on tissue mobilization, relaxation, and movement re-education, and follows a philosophy that physical change depends on a change of mind. So, how many of you use at least one of these in your lives, your personal lives? Okay, and how many of you use at least one of these in your work with voice clients or patients? Okay, wonderful, yay. And we'll get all updated today on that. So these are really not as uncommon as one might think, although I think we probably know these are common. NIH lists these complementary health approaches in a category called Other, so just other approaches. And so I took this right off the webpage. Anybody use any of these? If you know what they are. So I didn't know what a lot of them, okay, we have one, but he's one of our speakers, so we're not surprised. And so I'm going to define them because I didn't know what most of these are, so I'll quickly go through them. So traditional healers you may know about. These are people usually considered to be in a primitive society who use some long established methods passed down from one healer to another. Ayurvedic medicine is one of the world's oldest medical systems. It originated in India and has evolved there over thousands of years. Some of the approaches used in Ayurveda are herbs, massage, and specialized diets. Traditional Chinese medicine originated in ancient China, no surprise, and has evolved over thousands of years. Their practitioners use herbs, acupuncture, and other methods, and we'll hear about some of those today later on. Homeopathy is a medical system that was developed in Germany about 200 years ago, and its treatment is tailored to the person rather than to the illness. So you may actually find that two people with the same problem, the same disorder, might get different treatments. The homeopathic medicine is based on two theories. One is that like cures like. So if you create the same symptoms in a healthy person, that can help cure the person with the disease. And the law of minimum dose, which means that less of the treatment is more effective than more of the treatment. Homeopathic products come from plants, minerals, and insects or animals, and they can be found, you've probably seen them on the shelves of the store, in tablets, ointments, drops, gels, all kinds of different forms. Naturopathy is a medical system that's evolved from a combination of traditional practices and healthcare approaches that were popular in Europe during the 19th century. And there are lots of different things involved in naturopathy, dietary and lifestyle changes, stress reduction, herbs, exercise, detoxification, and psychological counseling. So really looking at a very whole person approach. And functional medicine is a term that is sometimes used synonymously with integrative health. But it also, more specifically, can refer to the approach that's more closely like naturopathy. So, in fact, to me, naturopathy sounds like integrative health. So, the terms are starting to blur. So I hope that this little introduction, which was probably briefer than I expected, but I hope that it gives you a common language to use, and a little bit more knowledge about all of the different approaches. The NCCIH website is really, really excellent, has a lot of great information on it, and it describes all of these and also the kind of research that they support. Really excellent. So as you can see, the term alternative is really no longer considered relevant. I kept it in the overall title on purpose because of its familiarity, and to emphasize that we in this morning's session won't be discussing the role of conventional medical practice. We're going to focus only on the complementary approaches. I think that voice specialists are historically more open to complementary techniques than many other healthcare providers because we already view vocal expression as part of the mind-body-spirit connection. It almost seems silly to make this topic sound like it's a current cutting-edge topic, but it really has taken this long for us to test these approaches using the scientific method to provide evidence for their use, and that's what I've been waiting for. I've actually been wanting to do this topic for many years and just waiting for enough evidence to amass. So that's why we're doing it now. And the speakers this morning are going to take us through a variety of topics that are specifically related to complementary healthcare approaches for the vocalist. So we have 4 speakers, 2 before coffee break, and then we get a half-hour coffee break, and then 2 after, and then we have a whole hour for questions and answers. So please keep notes during the sessions so that you can ask the speakers your questions during the panel discussion, okay? So we will not be leaving time for questions after each talk. So our first speaker today is Dr. Benjamin Asher. He is an otolaryngologist in New York City, and he takes an integrative approach to patient care in his practice. Dr. Asher was a meditation teacher before attending medical school at Drexel University. He served as chief resident during his otolaryngology residency at the University of Iowa and completed a fellowship in pediatric otolaryngology at Harvard Medical School. Dr. Asher has served on the faculty at Harvard, Washington University, and Dartmouth Medical Schools. He was on the board of the American Holistic Medical Association and founded and chaired the Committee on Alternative Medicine for the American Academy of Otolaryngology Head and Neck Surgery. I met Benjamin many years ago at this symposium, and I am thrilled to have the opportunity to host this session so that we could invite him here to share his approach to integrative and holistic health care for the vocalist with us. So Dr. Asher, please.
Thank you very much, Nancy, for inviting me. I feel very honored to be able to speak here and present and talk about a subject that is very near and dear to my heart. Some of the things that I'll be saying will be new information, some things will be old information, and some things will be somewhat controversial. And I just ask that you have an open mind and an open heart. And I'm a big fan of Brene Brown. Anybody here like Brene Brown? So I'm going to be vulnerable today. So I have no disclosures, and I own no supplement companies. I'm selling nothing. But I wanted to talk a little bit about bias, just in terms of how those of us that are practicing complementary alternative medicine versus this field of just conventional Western medicine. And there is an enormous bias in the medical community in subtle ways against alternative and complementary medicine. And then one of the big ways the bias takes place is that the field of evidence-based medicine, which I am all for evidence, and all the things that I talk about have evidence for them in this talk. I haven't put all the citations, but if you want to know them, I can provide them for you. But there's a bias because it costs a lot of money to do randomized clinical trials. And since the NIH funding was gutted under Ronald Reagan, there's no independent funding except for what comes out of Big Pharma. And so there is a huge bias in medicine towards Big Pharma because that's where the randomized clinical trials are going. But if you look through the papers, there are many smaller studies supporting the use of many of these modalities. And that's what I'm basing that on, as well as my clinical experience. I've been doing this for many years. So I've worked in the field of holistic and complementary medicine, or whatever the title is, I don't really even know anymore. But in any case, I've been doing this really since the very beginning of my medical practice, or my medical career. When I was in medical school, and I went to Hanan, that's what it was called back then, I was actually working with chiropractic students learning about manipulation at the same time. So I've been really interested in this for many, many years. As Nancy mentioned, I started out as a meditation teacher. I started meditating when I was 16, and I've been carrying that on, and I turned 65 on Sunday. So I do hands-on healing in just about everybody that comes into my office for whatever reason. My practice consists of, it's about maybe 15 to 20% voice performers, and then the rest of my practice is chronic illness, people that have been to everybody else and can't find a solution to their problems and are looking for some other way to treat what's going on. So I do a lot of hands-on healing. It's different modalities. I mentored with an osteopath for a number of years, so I do some osteopathic work. I do some myofascial work and energy work. I include that in all of what I do, and it's very effective. And in the last 5 years, I've been working with some indigenous healers. I've had some experiences going down working with this Mayan medicine man, which was a quite profound experience for me and completely radically changed the way I look at things. And I'll share a little bit about that. So when people come in with a voice issue to my office, I do consider the larynx as a big part of the problem, and then how we're using our voice, that's also a big part. But because of my more holistic approach, I actually look at the individual and their environment, how they're related to their families, and all the issues that are going on there, and how they're just their connection to everything is affecting their health. I look at them as psychospiritual beings, and I include that in what I do with people. And then in terms of looking at the whole person, I actually consider the entire infinite universe as part of the picture, and in the mystery, what the mystery is all about. People are coming in with anxiety and fear, and trying to work with how we're connected, what it is really to be a human being, how we're connected to the entire whole, is a big part of healing. So as it's obvious from what I'm saying, nothing exists in isolation, and I really work with that element as one of the fundamental principles of how I work. And this, the next statement, has really come out of my work with this Mayan healer in Mexico. And in my years of meditation, everybody talks about love, 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 but the profundity of love that actually exists as an energetic form is really the basis in the source of healing. So that is incorporated very much in what I do. It's important when we look at the healing versus curing. Curing is really eliminating evidence of disease, and that's a great thing if you can do it, but not every disease can be eliminated, and it doesn't mean that you can't have a healing experience even if the disease process isn't gone. And so in that case, healing really means becoming whole, becoming actually at peace or in totally in a level of understanding and a state of feeling that it's all perfect even as it is, even though there's a disease going on. So in my practice, I have it on my business card that I use chronic disease as a portal way to personal transformation, even acute disease too. So I've basically divided things up here in terms of my approach, and I'm including, so we'll start out with some of the physical measures that I use, and then I'm going to talk about the emotional and psychospiritual tools which are easily provided, and I'm going to speak a lot about that too. So just to begin with, because GERD and LPR seem to be one of the prominent issues that voice people come in to see me with, and the first thing I question is whether it's really real, whether a person really has that. In my own belief system is that it's kind of a little bit way overdiagnosed, and we as physicians have propagated giving patients proton pump inhibitors for many years. We were giving them out like candy. I wasn't, but many people were, and really they're bad drugs, and it takes many years for us to discover that a drug's a bad drug. So we should be judicious about our use of them, and the PPIs are really, they do a lot of harm. At one point, GERD was easily treated if you just give PPIs. I think that we really need to revisit how we're thinking about the problem. In any case, when a person comes to see me for that diagnosis, if they have it, I'm really looking at the why, not the I'm just going to give you a medicine to treat your GERD. So some of the things that I've discovered over the years that I think are very relevant is anything that slows down your digestion will probably promote reflux. So a lot of patients that have reflux also have IBS. There's a condition which you may or may not be aware of. It's becoming more prominent out there called small intestinal bacterial overgrowth. It's a situation in the small intestine where there's fermentation going on. It slows down the digestion. It causes a lot of bloating. And it's an easy test. It's something to test for. It's a breath test. You can actually do it. You can send people home with a kit. A number of patients that have reflux have SIBO. It's easy to treat that. Well, not always easy, but it can be treated both with medicine or with herbs. And the actual clinical trials on both show that the herbs are just as effective as the medicines are. It's surprising how many patients have intestinal parasites. Over the years, I've seen lots of people who come in with chronic stomach and reflux type complaints, and in fact they have intestinal parasites. There's an unbelievable parasitologist in New York City who's been doing it in his 80s, and some people say he overdiagnoses parasites, but I found that he's really saved a number of my patients with his treatment. A few years ago, when at this meeting, somebody from the Mayo Clinic presented something on yeast on the vocal cords, and I thought that was very interesting. And I've been treating people for yeast on the vocal cords for many years. Sometimes that looks like reflux, treating that. People who have been on antibiotics, people who have been on steroids, they promote yeast. People on inhaled steroids, yeast are a big issue. So treating that can often be very helpful. So in the realm of natural treatments for reflux, there are some that are really effective. The first one on this list is mastic gum. Mastic gum is a resin from a tree in Greece that comes in a capsule. I tell people to take 2 twice a day. It coats the esophagus. It's very soothing. It doesn't eliminate the reflux, but it certainly takes care of a lot of the symptoms. It also does take care of the voice symptoms. Magnolia extract is purportedly effective for tightening the lower esophageal sphincter, and I tell people to take 2 capsules of magnolia extract at night. It's a mild sedative too. It helps people sleep. Black raspberry powder it helps soothe the esophagus, and there's actually 2 papers out of Ohio State University showing that black raspberry powder, it's an antioxidant, will help convert Barrett's esophagus into normal esophageal mucosa. Digestive enzymes help speed up digestion, and I often will give those. Calcium citrate powder is a mild buffer, so that sometimes helps. And then there's been a lot of talk about alkaline water and an alkalinizing diet, which also can be helpful. This time of year, allergies are big. Some simple things for allergies. The two big herbs that are in most of the natural allergy products are stinging nettle and quercetin. Stinging nettle is an antihistamine, natural antihistamine. Quercetin stabilizes mast cells. Butterbur, it goes by the brand name Patadolex. It's sold by several companies. In head-to-head trials, this is in one of the Laryngology journals, with comparing it to Zyrtec, it was equally effective. A dose of 50 milligrams twice a day. It's not drying like antihistamines are. There's a lot of work on the microbiome now. You can't pick up a medical journal or a medical throwaway or anything. It's not talking about the microbiome. There are probiotics ads all over the internet. But there's some interesting work going on out at UCSF on the microbiome in people that have chronic sinusitis, and finding that people that have chronic sinus disease actually have fewer bacteria in their sinuses than they should, less broad spectrum bacteria. And one of the ones that they found is deficient is something called Lactobacillus sakei, and there's now a product on the market called Lantosinus, and there's another product coming out called Sure Sinus, which have this bacteria in it. And I've been telling people to rinse their mouths with it, and then sometimes put in a little bit of irrigation. And it's very helpful for people with chronic sinusitis. I've seen it help shrink polyps, and it does eliminate a lot of symptoms, and it does help patients with allergies too. Getting sick is the bane of performers, or vocal performers, and really providing immune support, trying to do things to keep people from getting ill is very helpful. This particular product, AHCC, which stands for Activated Hexose Correlated Compound. The brand name is Immunokanoko. There are lots of papers on PubMed about it. It's quite an extraordinary substance. And it stimulates killer cells, it stimulates dendritic cells. It's been shown to be helpful in people with hepatic cancer. I just saw an article that came out about it eliminating human papillomavirus. But it is really effective in preventing colds in my experience. I take it religiously, 2 twice a day. I tell my patients to take 1 twice a day. It's expensive, that's the only problem. Probiotics, there's tons of research on probiotics. There are studies out there showing that probiotics do prevent upper respiratory infections. The organism that's known to do that is Lactobacillus rhamnosus. And how probiotics do this is they're involved in immune modulation. So there's a very complex relationship of what's going on in the gut and what's going on in our immune systems. Those of us that have been practicing integrative medicine have been preaching this for many years, and finally science is catching up to it. Antioxidant support for vocalists, I think, is very important. I made this serendipitous discovery that glutathione is very helpful for the voice, and I've been using it for many years now. I use it by the gallon, the vocal folds are actually full of glutathione. Glutathione's an antioxidant and protects the vocal cords from oxidative stress. In high doses given intravenously, vocalists report that it really, and not every vocalist reports this, but enough to make me believe that it's true, that it really helps making singing more effortless. So people that are under a lot of vocal stress, I give it to them intravenously, but you can take it orally. It used to be said that it's not absorbed orally, but in fact it is. There is one company that manufactures it for a number of supplement companies. Its name is Cetria. If Cetria is on the label of a product with glutathione, it is absorbed orally. There have been studies that have shown that. Other products that are also absorbed orally that are not Cetria glutathiones, there's Ready-Sorb glutathione, which was developed by an old laryngologist named Tim Guilford. Trifortified watermelon is another liquid. Redysorb and trifortified watermelon are both liquid. Liposomal glutathione by Pure, that's acetylglutathione. S-acetylglutathione is by Zymogen. I tell all of my performers that they should be taking glutathione orally no matter what. Adrenal support, not everybody has to have Addison's disease to have adrenal fatigue. We live in a chronically stressful world, and having lots of stress does tax our adrenal glands. People that are under lots of stress have very elevated cortisol levels, and there are things that can be done that will help mitigate that. Those substances that help support the adrenal glands are called adaptogens. So they stabilize cortisol. If you do salivary cortisol levels on people that are under lots of stress, you'll find that either they're flatlined and they don't have any morning cortisol, or that their cortisol levels are just off the charts. So these adaptogens help stabilize that. They help stabilize the adrenal glands in times of stress. Rhodiola rosea is the most well-known one. There's an Ayurvedic herb called ashwagandha and holy basil. Rhodiola rosea goes by the brand Rosavin, but a number of the supplement companies put together adaptogenic herbal products and supplement products to help support people in stress. This is very helpful. These products are very helpful for patients that have a lot of anxiety. Sleep, which I didn't get enough of last night because I was so worried about my talk. But in any case, there are things that will support sleep, natural products. Number one on the list is magnesium. Magnesium is very relaxing. And I often tell people to take magnesium glycinate or magnesium citrate in a dose of 200 to 400 milligrams about a half an hour to an hour before they go to bed, and it will help support sleep. The rate limiting step on magnesium is on too high doses, it will cause diarrhea. Melatonin is also really good for sleep for some patients. The drawback with melatonin is it often makes people feel very groggy in the morning. I don't know if people have taken it and had that experience, but people do report that. There are a number of other quite excellent sleep products out there that have natural substances, GABA, 5-hydroxytryptophan, L-theanine, all work. It's always trying to try empirically what's going to help somebody. Some products help some people, some products help others. Some products help other people. So, now, on the emotional side of life. Hidden sources of voice issues. Trauma. Physical, sexual, emotional. And I put in here abusive voice education. And this is no joke. I have a Facebook page, and I post. I may get up to 1,000 people looking at any particular thing, and it's like I consider that's great. Wow. Well, I did a post about abusive voice education in PTSD. I got 15,000. It's a really big issue. Voice teachers can be very shaming. They can be quite nasty. And I've had patients actually have performance anxiety, needing to be on Inderall before performance. And when I ask them, did you have an abusive voice education, they start crying in my office. It's a pretty big deal. So something needs to be done. More awareness needs to be made about how it is that we teach people. Other issues that are sort of hidden and I think result in voice problems, repressed grief. And I've talked about that here before, actually. Repressed rage. Anything that we're repressing, we're tightening our throat. And I'm talking a little bit more about performers that get characters stuck in their bodies. Everyone, and I mean everyone, underestimates their stress level. I include myself in that category. If you ask any person that walks in your door, are you under stress? The answer you will get is, I am not under any more stress than anybody else. That is always the answer. And I always wonder how they know how much stress everybody else is under. But in any case, being a physician or being anywhere where you actually meet people on a day-to-day basis and people tell you their stories, I know that not to be true. Some people are under enormous amounts of stress, just aren't even aware of it, but it's rampant. This is a fundamental piece of health that needs to be addressed. And I think that we have to, as physicians, provide patients with tools to deal with that. Trauma survivors underestimate their level of trauma. And I hear stories, this is absolutely true. I asked a patient who was in chronic pain if she had had any trauma. And she said to me these words, "Does being raped count as trauma?" It is unbelievable to me how we hold these deep-seated issues in and don't recognize them and don't deal with them. But if we don't deal with them, that has an enormous impact on our health. And that's true about, I'd say, 90% of the chronically ill patients that I see. They have these deep issues that they've never dealt with. So why is it that these are obvious, like this is kind of, I'm pointing this out, this is like a no-brainer, right? But we don't deal with it. It's the elephant in the room and we never deal with it. So why? There's no time. The way the medical system is totally, it's fear-based and it's not about healing at all. It's about generating revenue for the system at this point. There's no time. The widget counters are on our backs. There's low reimbursement for visits where we talk to people. Really, it's a procedure-driven model. How can you make more money with a procedure? Not really discover what it is that's making this person tick. And then there's all this administrative stuff which just gets worse and worse and worse every year that sucks up all of our time. Now, we as physicians have a lot of shortcomings about this stuff and don't want to deal with these issues. I think when medical education ingrains fear in us, and it's like, I don't want to do something that's outside of my realm of specialty. So if you have a mental health issue, I don't really want to talk to you about your mind. You got to go to a psychiatrist or a counselor because it's way out of my. But really, all a person wants to do is be heard or seen, and you just have to ask the right questions if you want that. Surgical training is often abusive. Mine certainly was. I would say that I had PTSD after my surgical training. And I think the fact is that when you have been subject to lots of abuse yourself, it's actually hard to bring it up with somebody else because you haven't dealt with your own. Physicians often ignore their own stress, burned out, blame others, and there's actually a really interesting study comparing surgeons to airline pilots. And airline pilots know when they're stressed, they know when they should stop working. They do stop working. Physicians, surgeons don't know when they're stressed, don't know when they need to stop working. And there's basically, airline pilots took responsibility for their problems, and they found in the study that physicians often blame others. So, in any case, these are issues that we have to deal with, but I think that if we did, it would make us more helpful to our patients. So, running out of time here, but mind-body tools for trauma, EMDR, eye movement desensitization and reprocessing. It's an incredibly effective tool. It's very simple. There are many practitioners of it. A person goes into their traumatic experience, and when they're in it, the person has to move their eyes. It resets the brain. It is very effective. There's a lot of research on it. It's very helpful for trauma. A few other trauma tools, somatic experiencing, safe and sound protocol, are also helpful for trauma survivors. The thing that's on the horizon and will be legal in 2021, it's in phase 3 clinical trials, is MDMA-assisted therapy. MDMA is the street drug ecstasy. It's an pathogen. It opens the heart. And with a therapist on hand while you're under the influence of this medicine, You're able to look at the deepest trauma, open your heart up to it, accept it, and then move on. It is incredibly effective, and I've seen videos of people under the influence of Iraqi war veterans. It is absolutely remarkable. For anxiety, one of the tools that I use is EFT, Emotional Freedom Technique. It's a tapping tool. Basically, it's very simple. You tap on your hand here with, you do a setup statement, which is something like, even I'm incredibly anxious, and then it's, I deeply and completely love and accept myself. You do that 3 times, then you tap on these, when you're here, you tap here, basically making a statement, and it reprocesses whatever is going on. It's incredibly effective in the moment dealing with difficult issues. You can do it in 2 minutes. Thought field therapy is another type of tapping. CBT, cognitive behavioral therapy, a lot of research on that, and anxiety. DBT, dialectic behavioral therapy, I think is a little bit better, in my opinion. Just in terms of my own, when I see a lot of performers having a lot of physical issues, I often ask them, particular actors, where is this character living in you? Because oftentimes the character's stuck in their body and they can't get it out. They don't even know it. So I tell every actor that what they need to do is at the end of their performance at night or at the end of their shoot or whatever it is, they should do some character clearing ritual. They need to reclaim themselves back. So either say goodbye to their costume, to pick a picture of their family, reclaim who they are, get rid of that stuck thing that's going on so that they can move on. Grief processing, I would tell people to take a photograph of the person that's died and write a letter to them. It is an incredibly effective tool for managing grief. I tell people to go to a safe place where they can process, where they can let their feelings up. They write a letter, unedited, don't worry about the grammar. Write the letter, then take the letter and burn it. It works. It's quite amazing. Journaling to release rage. John Sarno, who was a rehabilitation doctor in New York, started this, and people journaling about their trauma, journaling about the rage, very, very helpful for managing chronic pain. Meditation techniques. Transcendental meditation, very easy to learn. It's taught all over the world. We taught the same everywhere. Very helpful for relaxation. Mindfulness-based stress reduction based on the Vipassana techniques out of the Buddhist tradition, also very helpful. Guided imagery, you can get guided imagery tapes in numbers of locations on the internet. Neural and biofeedback, you need to work with a practitioner. There are apps, Headspace, Calm. They're a lot of people use them. In my practice, I recommend people, whatever meditation they do, something that people talk about gratitude, and I'm not a big gratitude, like just be appreciative of all the great things for what's happened to you, but when I look at gratitude, it's gratitude for everything, even non-great things, the very fact that we're alive, the very fact that we're here, the very fact that there's an earth, whatever it is. So I have people meditate on gratitude. I say the word gratitude 4 times in their mind after they're meditating. And then divine love, whatever that means to them, however that comes to them, and that everything is perfect as it is now. Just 3 books that I recommend to patients who are struggling with different issues. The first book is called The Path is Everywhere by Matt Licata. And basically, this is an amazing book about working with shadow feelings. People are having difficult emotions coming up. And it's not a way of affirming your way out of them or pushing them out. It's a way of just allowing them to move through and experience them so that you're not stuck in them. Wherever You Go, There You Are by John Kabat-Zinn is a great book for just beginning to work with mindfulness. And the last book is a book by Pema Chodron called When Things Fall Apart. Obviously, that's happening all the time, and the title is helpful for people who are having that experience. So, that is actually my last slide, so there we go. Thank you.
take a moment and appreciate all of that wonderful information. Our next speaker is Dr. Jennifer Nasser. She is a registered dietitian, associate professor, and director of the PhD program in nutrition sciences at Drexel University here in Philadelphia. After getting her undergraduate degree in chemistry and her master's in biochemistry, she got her PhD in food science and nutrition from Rutgers University of New Jersey. And her research addresses obesity, eating disorders, and aging, and particularly on dopamine-mediated mechanisms of regulating food intake. Interestingly, I found online that her work got some national attention in 2013 when the National Geographic wrote up her findings that spikes in dopamine could be detected with electroretinography, so looking in the eyes, when people ate foods that could be considered addicting. So please welcome Dr. Jennifer Nasser to the stage for her presentation on the necessity of nutrition.
Thank you, Nancy. I'm very happy to be here. This is the first time I'm attending the Voice Foundation, and it has special meaning for me because I not only am a trained scientist, but a trained singer who tried to have a career many years ago and got ill, and to treat the illness, it sort of made a mess of the voice for a while, so the window of opportunity went away, so I continued on with the science part of my life and get to sing for fun and on the side. But I think it's important when we use our bodies as a particular part of our expertise and our source of income, as well as a source of pleasure, that we do what's needed to fuel the body. And so the title of my talk is Nutrition, a Necessity, Not an Alternative. So I'm not going to talk about illness and what to do while you have an illness, but I'm going to be talking more about what should be done so you don't get some of the common non-communicable diseases that are affecting our population today. So the presentation will include why is nutrition a necessity? How do we know? What are some of the the nutrition needs of vocalists? And the role of the coach in supporting good nutritional status, and then dietary supplements, yay or nay. And I think it's kind of serendipitous that I'm following Dr. Asher. I have a slightly different perspective on this, but that's good, because if you know anything about science, or when you get two scientists in a room, we're trained to disagree. Not on a personal level, but to reveal the truth, you need to have somewhat of an adversarial or disagreement, much the same way as our legal system. And within a disagreement, hopefully there'll be some compromise arrived at, and you have a greater understanding of truth. So, why is nutrition necessary? Well, the simplest and most important is survival. We can exist basically for only about 3 days without water, and water's part of nutrition. We can exist for about 3 weeks without food. That's if you happen to be at your ideal weight. If those of us who are more endowed, we get to last a lot longer, but we have other problems in between. One of the main reasons that we can only survive for a small period of time is because of our brain. The brain requires a continuous supply of energy, 24/7, 300, that's not 3, that should have been 365 days a year. The brain makes up about 2 to 3% of the mass of the body, but uses 20% of our energy. And it uses the same amount of energy during sleep, so that even though we're not conscious of a lot of things, our brain is still chugging along as it did all day long. Now, one of the things I get asked a lot as a dietitian is, what about these terrible things called carbohydrates? Should I be restricting carbs? Should I eat more of a keto diet? Well, let me tell you, your brain needs roughly 120 grams of carbohydrate a day. And it ranges, depending on your activity and your size, from about 110 to 170 grams. Now, what is that? That's the equivalent of 7 to 11 slices of bread. So, if you're not giving your brain that amount of carbohydrate, which of course gets processed and turned into glucose, then your body's going to have to work extra hard to produce that anyway. So that when people ask me about, should I go on a keto diet, it depends on whether you have some very defined medical illnesses, which we now know from evidence that inducing ketogenesis will help. And then there are some potential advantages to ketogenesis that are still under experimentation, that haven't been proved yet. But what I like to explain to people is that even if you're trying to lose weight, you'll lose weight just as fast if you restrict your carbs to 120 grams a day to feed your brain. A lot of the weight that you think you're losing if you don't eat carbs is really weight from water, because when you eat carbohydrate and carbohydrate gets stored in your liver, it stores water with it. So you have to remember that the brain comes first, and the brain needs about 120 grams of carbohydrate a day. Okay, what else? We need food because our body has a hierarchy, a differential way that it stores energy. Fat is the only macronutrient that we store in a large amount that doesn't have to be replaced every 24 to 48 hours. People are very surprised when I tell them that all they need to keep from having a fat deficiency is 1 tablespoon of vegetable oil a day. That's all you need, because 1 tablespoon of vegetable oil will give you the amount of essential fatty acid. That's the fat that your body can't make for itself. So everything else is for flavor and texture and enjoyability. Now, carbohydrates are stored as starch. We call it glycogen in animal products. And that's stored in the liver and a little bit in your muscle. And that has to be replenished every 24 to 48 hours. You make a big dent in your carbohydrate stores just by sleeping for 8 to 10 hours of the day. And we don't store protein. We manufacture protein. So when people say to me, should I eat extra protein? Should I take digested protein or amino acids? Your body doesn't store what you're eating. Your body breaks it down and then rebuilds based on its own genetic makeup and hormone levels. And your supply of amino acids in your blood turns over every 8 to 10 hours. So you have to have protein every day. Now, fat vitamins such as vitamin A, vitamin D, vitamin E get stored in our fat masses. And depending on the particular vitamin, they can last for quite a long time, months or years, before you might see a deficiency. But water-soluble vitamins and minerals need to be replenished every day, and if you don't have them, you can get signs of definite deficiency within 7 to 14 days. So how do we know this? Well, some of the ways we know are what we call observational studies of eating in humans that can give us an association between a nutrient and health. And it's very important. You hear a lot of criticism right now. One day you hear a talk and eat this or don't eat that. And then over here somebody says, well, you can have caffeine. And then somebody else says, no, you can't. One of the questions you need to ask yourself when you're hearing all of this noise is, what's the noise? What's the signal? What's the real information? Is this a study that is telling me that eating something is associated with health? Or is this a study that can tell me that if I eat this, it can cause something bad or good, or it can cure something bad? So we have two kinds of messages that sometimes get very garbled in the media: association and causation. Now, why do we do that? Well, some information that we need cannot be generated in a short period of time, right? If I want to know what do I eat so that I don't get cancer, well, it's not ethical for me to give you or myself cancer 1 minute and not give myself cancer another to prove that point. And that's what would be needed for a causative study. So then how do we get information? Well, we look, we say, okay, in this society they have fewer people who are getting breast cancer than in this society. And we say, well, what are these people eating? What are they doing? What are their lifestyles? What's their stress level? All of these psychosocial and environmental factors, and we compare them between one society and another. That's called association. Association is two things happening at the same time. One may impact the other, one may not. We don't know. What we know is some societies living their way in their culture have less incidence of cancer than another. So if you have a choice of how to live, what are you going to choose? Because you don't have the option of doing the definitive study. Other types of studies are called prospective studies. What's that? Well, a prospective study is I give you a particular food or a nutrient, and I put you in a restricted environment so that I can guarantee that you are eating exactly what I want to study. Now, a lot of those studies are done with animals. Some of them are done with humans, but there are only maybe 10 centers in the whole country that can do those types of restrictive feeding studies that have facilities to have people under 24-hour observation and living conditions. I have a colleague who works at a USDA center out in North Dakota, and at her facility they have a hotel where type of place. They bring people in for nutrition studies. They can handle 14 people housed and fed and living for 6 months. That's wonderful, because then they can say, okay, you're going to eat this diet for 6 months. They can do collect all of their blood values or whatever kind of scientific information they need. And they can guarantee that what they gave them to eat got eaten. I don't have that ability. Where I work up the street, we have wonderful research labs, but we don't have residential labs at Drexel. So when I do studies, I do short-term studies in my laboratory. And to thank you, Nancy, for the plug from 2013. And then in the last couple of years I've been on some other TV shows, but one of my deans said to me, you know, if you didn't study pizza and chocolate, nobody would pay attention to anything you're doing. And I had to laugh, because when I first heard it, it was kind of like a, oh, okay, you know, slap in the face. But in effect, she's right, because, you know, when Nancy first started to read what I do, you know, she studies eating and dopamine mechanism, right? And then she said, well, it was on National Geographic because she talked about shining a light in the eye, which is much more user-friendly than telling people I'm going to stick you in a machine that measures magnetism, and for the next 45 minutes you're going to hear nothing but bang, 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 but please don't move around and stay put. So that's less user-friendly. So that brings me to the point of, again, with information. The information that we get in the media is the information that the media people will feel is attractive to those who are going to access the media. There's tons of nutrition science being done that never makes it to the front page or the 32nd back of the newspaper or on the internet. Partly because they're not doing their scientific studies using pizza and chocolate. They may be using a cell system or whatever, so they're testing for the dopamine too, but who knows what that means, right? Because that's not what's going to make it to the front page. So I just caution you all, when you hear diverse results or you hear comments, nutritionists don't know what they're doing and you can't trust the data, you're getting a filtered view. Okay, what other kind of studies do we have? Another kind of study is called epidemiological surveys. And those studies are, again, more based on comparison of populations. Epidemiological surveys use self-reported information, and we know from, if we compare data from self-reports versus data that we see in the laboratory, that sometimes people can underreport what they eat, underreport how much they weigh, and overreport how tall they are. That's just how we are. And, you know, you can say, oh, why are they lying to me? They're not lying. I've done a lot of studies where I've actually looked at how aware people are of what they're eating, how aware I am. I mean, it's amazing to me that I lose weight when I write things down that I've eaten, right? And then if I forget to write things down for a couple of days, I could say, oh, I'm not eating any more today than I did yesterday, but when I go back and journal, it's like, oh gee, I did. And I'm in the business. So I think that this is part of our protective mechanism. Eating is so important to our survival. And this is my opinion now. It's, you know, I haven't done a RCT to prove this to you. But eating is so important to our survival, and it has been from the dawn of civilization, that to be overly aware of how much you're eating could have been detrimental in the times when food was scarce. Now that we're in an environment of food plenty, 24-hour, 7 availability, it's not an advantage to us to not be aware of what we're eating. But if you're running around all the time as a hunter-gatherer trying to find your next morsel, you know, you don't want your little voice in the back of your head saying, well, what are you doing that for? Because you just ate 3 hours ago, you know, sit down and rest a little bit. Because in another 3 hours, there may be nothing in front of you, and if you didn't run for those 3 hours to a place where the food might be, you won't get any. Anyway, that's my theory. Okay, how how do we know? What are some of these famous studies? Well, one of the first indications of the association of food and health came from seafaring workers, way back, even back as far as the late 1400s. The observation was made by a Portuguese sailor that eating citrus fruit, fortuitously, they came from the Mediterranean region and the citrus was around for a while. So when they were out at sea for a number of months and then would pull into a port where they would have oranges or whatever, all of a sudden their gums, they'd be able to stop having bleeding gums, which is one of the signs of scurvy. There are other more serious ones. But nobody put that together until about the 1700s when a British surgeon made that observation and recommended that the British Navy start putting citrus fruit on their ships. But even that wasn't adopted for another 40 years. And then in the 1930s, a scientist was actually able to synthesize something called ascorbic acid, which is the main ingredient of vitamin C, and then do studies in guinea pig to show that if you give vitamin C, that you can correct for scurvy. Okay, now this isn't for memorization, but just to show that the field of nutrition just in the last 100 years has exploded with respect to types of research that it does and the interest. This came from a recent issue of the British medical journal, BMJ, and I believe that's open access, so you should be able to find that if you're interested. And what it shows is, you know, in the early 1900s, we were in the era of vitamin deficiencies. And once we figured out that vitamins were important, then we move into how do we access and get this to the public. One of the upsides, as if any war can have an upside, of World War II was that when they recruited, excuse me, when they had mass recruiting, this is water, I promise. When they had mass recruiting in World War II, they found that a lot of the young recruits had vitamin deficiencies. And that began the public health nutrition movement in this country, which was addressed through something called fortification. Carbohydrates were a big staple of the diet at that time, and so they came up with the idea that we're going to add vitamins back to carbohydrate foods, bread and rice and pasta and cereals, and that this would help correct for vitamin deficiencies in the population. So to go back again to questions about diet, if you cut carbohydrates out of your diet, you got to figure out how you're going to get your vitamins, because most, yes, am I, vitamins. Okay, let me move along here. So what about general needs for vocalists? We all need hydration. But I bet most of us don't realize that we can get some of that hydration from food. And these are some of the foods that not only are healthy, but also have high water content, and your body can use those as a source of water. And then current guidelines, if you go to dietaryguidelines.gov, you'll get the current dietary guidelines. There's also a committee right now that's meeting to develop guidelines for 2020. So you can very easily read those online. What about vocal production? Now I have to admit I borrowed this slide from the internet, and as teachers, some of you probably know more of this than me, so I just wanted to show you what some of the information is that's out there. I can't guarantee, I didn't make the slide up, so I'm not sure what the evidence is on any of this. Okay, now what can you do as a coach? First of all, recognize, and probably you already do, that the life of a performer can be very stressful, but it can also mentally and physically, but it can also be very stressful nutritionally. Time demands. Trying to juggle work to pay your current bills while you're running around auditioning or performing in one place and living in another can promote irregular meal patterns and food intake. You have physical demands because you want to play a certain role, and that can make you restrict what you're eating, which can affect your health. You may have strained financial resources, which can make access to healthy food more difficult. Unfortunately, we don't subsidize fruits and vegetables in this country. We subsidize grain products that are used to make junk food, but we don't subsidize fruit and vegetables. Lack of personal space, if you're sharing a space with a number of people, or if you're on a tour bus for a period of time, may be harder to purchase and store or prepare healthy food. And if your stressors get too difficult and you don't turn to some of the healthy alternative methods, unfortunately some people turn to chemical substances which can dampen appetite, be used to replace food, and have their own negative health effects. Now, what can you do actively as a coach? I'm sure all of you have materials and pamphlets in your studios that are on all sorts of things for your students. There's a very easy checklist that you can download called a Determine checklist, and this was developed actually for community living senior citizens, but it can be applied to performers or about anyone. It basically talks about psychosocial, environmental factors that can affect nutrition health. Availability of funds, availability of cooking facilities. Do you live in a food desert where the only store has junk food and canned foods, no fresh fruits and vegetables, no low-fat dairy, that sort of thing. There are also a number of online screening tools for different types of addiction. The audit tool is for alcohol, and the HONK is called habitual use of nicotine, is for screening for smoking. If you go to NIH.gov or CDC.gov, those are two government websites that can give you a lot of health information and screening tools. Now, what about dietary supplements? I'm a big fan of vitamins, a multivitamin and mineral, when you have a busy schedule and an irregular eating pattern. You know, dietitians say get everything from food, and that's great. You know, if you're living at home and mom's doing your cooking for you, and when I come home from my mother, I lose weight all the time, my skin's nice and bright and shiny and all that. I love to cook, but who's got time, right? As a dietitian, I am very leery of single nutrient or single component high-dose preparations. Why? Because the industry, even though it was very expensive to do RCTs, the supplement industry was able to get a law passed called DSHEA that restricts the FDA from having any say even in the safety of their product. And I look at that and say, wait a minute, I wouldn't eat in a restaurant that could choose not to be inspected by the health department. Why should I pay and take a supplement from a company that chose not to, and got a law passed that says the FDA can't check my facilities, can't check the purity of my compound, whatever. The FDA has more control over a can of chicken soup because it has protein in it, than it does a supplement. So I'm not talking about the science of a supplement, I'm talking about the environment of providing supplements in the US today. And let's skip a little bit of the science and just go for practical advice. Eat a balanced diet, drink lots of fluids, and if you need help adjusting your diet to your work plan or you want to know more about nutrition, talk to a dietitian. Thank you very much.